Welcome to No Way But North, where we talk about the miracles of recovery and the tools used to achieve them. My name is Cooper Lyons. My clean date is November 27th, 2010. I almost started with the year there for some reason. As always, I am joined by my co-host, Big John Meldrum, fixing his glasses, fixing his hat, making sure he's looking good.
Always.
How you feeling today? You're finally kind of out of the vacation
out of
brain.
The fog.
Yeah.
Man. Took
Today's recording session. You've been a little.
What fog?
His vacation.
The vacation fog.
Oh, that's the worst fog.
Just
ever.
like just like your brain's like
all day today.
It's like a slow chugga engine.
Postpartum fog.
Is that what it is?
It's a good little like intro into work tomorrow, though.
I mean, I worked yesterday, but
oh really?
I drink a lot of coffee like first thing in the morning. I was chugging it. Didn't even care. 2 assessments, group, visitation, talking to families, getting it down. Woo!
That hurt my ears.
This is the John I've been missing for so long.
Yeah, baby.
A whole week, which is a long
Running
time.
it on your own and killing the game.
Trying.
I'm hyper now. Now I'm not going to sleep until.
All right, I got a long intro for Daniel, so you gotta give me some time to get through it.
Do you want me to introduce him since he's my lead counselor?
Do you want to? That'd be a first.
No, not
That's
really.
What I thought. It's more work for you. All right, Daniel Griffin, an avid mountain climber, bike rider, and ultra marathon runner with glorious locks of hair, is here to talk to us about the disease model of addiction.
Glorious.
After high school in Rexburg, Idaho, Daniel traveled throughout Europe in 2004, lived in, correct me on this pronunciation if it's wrong, lived in Kumasi, and Cape Coast of Ghana, right? Saying that right? Okay. In 2008 and 2009, eventually returning to Rexburg to attend BYU, Idaho in 2016 to get his undergrad in social work and immediately following it up with his master's in social work from Boise State University, go Broncos, 2018. Since then, Daniel has been a primary counselor at Ashwood as well as Northpoint. That's a pretty good job coming right out of the master's program.
I know, I was totally undeserving.
Wait, so you backpacked?
Meaning he has treated the entire Assam continuum of care. Go ahead.
You backpacked across Europe?
No.
Or you just went and spent some time?
I went with my parents, actually. I was a 16-year-old.
Oh, so you were still young.
Yes.
Okay.
I dug deep on Daniel's Facebook page for that.
Yeah, when I read that little
info.
thing, I was like, how does he know any of this?
I dug deep.
So you were just,
Daniel.
why didn't you just ask
Did his
him?
LinkedIn, because then I don't get that reaction. And like they don't feel like they're going to just be interviewed the hell out of.
So Cooper's a part-time stalker.
Yep.
So
100%.
Now
but
we
it's
know what he
not weird
does.
because it's for a purpose. It's recorded.
I mean, I feel like all stalking is done for a purpose.
I mean,
yes.
but not a good
True.
purpose. All right, guys. So today's quote. Is there anything on there that I missed or got wrong? Perfect.
That he's a rock star.
I didn't. Oh, okay. All right. Yeah.
Aspiring rock star.
Aspiring. He has the hair though. Look at that hair. Can we
know.
get a zoom in on that hair?
No,
Can
we can't.
We can't get a little zoom in.
It's ridiculous.
His locks are luscious.
So I used
today.
to think that the COO, Bobby, president.
Oh, yeah. Sorry. I thought you were starting to spell my name.
I used to think that the COOPER. I used to think that he wanted me to keep this hair because he liked it. Turns out he was just kind of like trying to make me feel good about myself.
He doesn't like your hair.
He told me the other day it was ridiculous, and so now I'm going to cut it because I'm a slave to his will and whim.
No.
Don't you dare.
Don't do it.
Your boss.
We like
Think about it.
Your boss
Yeah.
says, "Don't cut
Your
those."
boss says.
Well, I'll take the lash from that.
Okay.
You don't cut those luscious locks,
Oh,
bro.
okay. Okay, it's settled then. We're good.
All right, guys. So today's quote has nothing to do with hair. Every human being is the author of his own health or disease. I'm going to
Swami
Swami
Sivananda.
Sivananda. Sivananda. Sorry for mispronouncing your name.
Isn't there a
if you're
food
watching.
called Swami? Shawarma.
That's
I just saw it off the Avengers.
that's from that's a Greek food. That's lots very similar to euro.
Oh.
Yeah.
It's Greek?
Pretty sure.
Oh, okay.
I mean, it's at Greek restaurants. Put it that way.
Okay.
We're getting on all
Well,
kinds
so
of
I'll
tangents.
say this. Going back to that quote.
Yeah.
Do you agree with that? Every man is the author of his health or disease? Is that what it said? Can you repeat it
In
for us?
his own health or disease.
Yeah.
Ooh.
I don't
I don't know how I feel about that.
Yeah, I think that I think this has everything to do with the topic today of the disease model of addiction. Because, and obviously I'm no expert at any of this. I'm still learning a lot. I just got out of school last year and everything, but I know that there's research to indicate that you can trace addiction to genetic markers. man does not author that, right? Man will author how he basically interacts with those markers, I would say. So, got to break that down.
100%.
You know what I mean? I mean,
Yeah.
like, in some way, no. Man is the author of his reaction,
Yeah.
right?
Ooh.
That's what I'd say. There we go. Write that one.
Write that down.
Reaction.
Quote. I was just kidding. Don't. Gosh.
I like to make Daniel feel good because he's so hard on himself.
I know he is.
What do you think about that quote? Gonna make me read it twice, as per usual. Every human being is the author of his own health or disease. I'm not going to try to say the person's name. Swami Sivananda.
I mean, I agree with it to an extent. You know, we definitely write our own path, you know, based off of our decisions. But when you talk about like disease, especially, you know, with today's topic on the disease model of addiction, you know, there's an aspect of choice that falls into that thing, to that theory. But, you know, sometimes, you know, every human being is the author of his own health or disease. You know, sometimes we don't have a choice, right? Sometimes those things are out of our control.
Yeah, there's certain dispositions.
Yeah,
Right? Yeah.
you know, I can't choose. Some people can't choose whether or not they have cancer, right?
Right.
Some people can't choose whether or not they develop some type of rare condition. You know, so for you to say that they're the author
yeah.
of the way they write their lives, yeah, I think they're an author in the way the choices and decisions they make. Absolutely. Talking about the disease model of addiction, like that falls into that. Like you choose to take substances now, whether or not you become addicted to that, that's a crapshoot, right? Me, all of us, every single person in this room, we all could drink alcohol, right? We could all drink the same amount of alcohol, and one of us could walk out of here becoming an addict.
Yeah.
So my thought is to me that's saying that I'm responsible for my own health or disease. So it's my responsibility what I do
Right.
with whether that's eating healthy and working out and avoiding carcinogens and doing those things. And even then I still might get cancer or
Right.
you know, avoiding drugs or not avoiding drugs, and then I might end up with addiction. And even after those things happen, even though I might not have anything to do with it because my family is just latent full with addiction or cancer, whatever it is still my responsibility with how I deal with that, how I handle that, whether that's treatment, refusing treatment, doing the things I'm supposed to do, eating right, those things. So I'm still authoring how that disease progresses to a large extent.
Yeah.
And that's not only like the physical things I do to take care of myself, but how I think about having cancer or having addiction, how I
Correct.
carry myself. That's kind of what happened in my head.
Yeah, it's interesting to put the context of addiction onto that quote because I think what chair you sit in determines where you stand on any given issue. You know, I know John's been in the prison system, you know, like now you're a counselor. You know what I mean? Like in some ways it probably, like if you weren't working in substance abuse, your opinions might be changing a little more radically. You know what I mean? From one job experience to the other because the
absolutely.
context of the people you work with is so different. I think that in terms of that quote, when you start talking about the disease of addiction, I remember, like, I've been talking to colleagues and stuff lately about how when I was first exposed to the disease model, I always thought, like, that's like, what, like poetry or whatever? I'm like, why are they saying that to try to sound smart or try to make it sound more serious? Which is glaring because I decided to go into this field, right? And so maybe I am just ignorant, which is probably true. But I mean, like, if me, having worked in substance abuse even before I got my master's degree, was kind of surprised and was really curious about that, how much more so is everybody else, right?
Yeah.
And so stereotype, I think, perpetuates how we treat it as a disease, literally speaking. Because
yeah.
I'll sit in an office every day with people who obviously are making decisions that are not in their best interest. And John, he does the same thing. And John used to also, you know, work with people who use substances to the point where they got put behind bars too, right? And so, like, there's this kind of push about how punitive are you with people who abuse substances, and so
Have a disease.
exactly. That you don't punish people with diabetes, you don't punish people with cancer, you know what I mean?
But
So-
those people with diabetes or cancer their disease also doesn't manifest in the same way.
exactly.
So how
it's
do
a
you?
disease of the mind?
Yep.
Strengthening neural pathways.
Well, so define for me what the disease model of addiction is.
Well, it's based, and obviously if any true expert or researcher were watching this, they'd probably want to slap me in the face. But I take into account, really, the way I look at disease is the ASAM dimensions, American Society of Addiction Medicine dimensions. I look at people's withdrawal potential, people's biomedical condition, their genetic factors and stuff like that, their emotional, behavioral, and cognitive experiences, so their history of mental health symptom struggles, that kind of thing. I look at their motivations to even look at those things and gain insight into what havoc they wreak on their lives. I look at their relapse potential and what continued use looked like for them, why they kept using, and then I look at their environment. Environment's huge, especially for a social worker. That's a lot of what I look at. You know what I mean? And so, so looking at those things kind of helps you get a better idea about why the disease is manifesting in a certain individual at that certain time in their lives.
Yeah.
Like we have people in the facility right now who first started drinking because it was normal within their family functioning at 10, 11 years old. We also have a lady right now who didn't start drinking until she was in her mid-30s,
And it took off from there.
Yeah.
So and the word disease conjures up that, or because brain disease, right? Because that's kind of what it
Yes,
is, right? Is that
right.
there's something physiologically, whether that's damaged or just created wrong, or
Dysfunctional,
developed. Thank you.
yeah.
Perfect word. So what's the brain physiology around addiction?
So typically it's just that, there's a lot that goes on in the pleasure center of the brain because the brain there's neuroplasticity. The brain has the ability to learn behaviors and unlearn behaviors, right?
Yep.
Through varying synapses of different neurotransmitters, neurochemicals, stuff like that. And I'm no biologist by any means, but basically, due to all these things I just mentioned, and especially genetic factors, somebody might get hooked on something like alcohol a lot easier than somebody else because of genetic factors, and then that part of the brain just gets strengthened and strengthened and strengthened through continued use to where the brain kind of defaults to that decision to deal with life stress or whatever it is, and so it just lives on that way.
Being conscious.
Right. And then there's using certain narcotics, you build receptors around that dopamine rush, and when you don't have it, all those receptors want it, and so they're crying out for more, and that's where you get cravings. You know what I mean? That's where that kind of stuff comes into play. It's menacing.
And then at the same time, the associations around healthy things like family and communication and social interaction and things like that are doing the opposite, kind of deteriorating away.
Yes, exactly.
Okay.
Yeah. Yeah, for the most part, for sure.
And then I know there's that big word that gets thrown around a lot, and I think a lot of people know about it, is anhedonia.
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 The inability to feel pleasure.
So why
Scary.
don't you guys talk about that a little bit?
It's creepy.
Well, in theory, what they say is substances, when substances are entered into your system and you start to feel that elation from the use, right? It takes you to this unrealistic
High.
right?
Because drugs are really good.
Right. Man, it feels
Heroin,
great.
for example.
Yeah.
Use heroin.
Yeah. So heroin, for example,
Don't use
right?
heroin.
Don't use.
Don't use heroin. But use heroin. No.
Yeah.
So you put a substance into your system, right? And let's say that on your greatest day without substances, you go this is your high right here.
Yep.
And then you use substances and it takes you here. But that's unnatural, right? So what ends up happening is you remove that substance, right? And you probably will drop below what normal is. But even after you have a certain amount of time where you're engaging in activities in life without substances, you may raise to that normal level again, but you've experienced a high that's unnatural, and you'll never be able to reproduce that. And so, I hear all the time, I used to like to get drunk and go golfing, and now I'm 6 months clean, and I hate going golfing. It's terrible.
So boring.
It's so boring. Well, it's not that they're not getting enjoyment, but they're not getting the level of enjoyment that they were getting with that false
That's the hedonic set point.
Thank you.
Yeah.
I've heard it described as pleasure deafness.
Yep. Yeah, I'd
Like
agree
the
with
things that should, like, even food. Like you don't get the same kind of pleasure out of eating healthy.
Yeah,
It's the same thing with eating like a burger, like a
Well, I'll
a
use
fast
like
food
you talk
burger.
about substances like ecstasy, for example, right? You all your senses are heightened, and you're operating up here,
Yeah.
right? And then you come off
On
of
the
it,
pleasure scale.
On that pleasure scale, right? You set this hedonic set point. So now, if I'm trying to, so for example, I'll use sex. That's a big thing that our patients talk about. I use substances, and when I have sex on substances, it's up here, right? Now I'm off substances, and I'm having sex, and like it still feels good, but it's like I remember when it was like this.
Yeah.
And it's not that they're not having
Probably
fun.
reaching out of the frame, but he's reaching really high. He's too tall.
Sorry. Boom! Through the ceiling.
Through the roof.
Through the roof.
No, he meant to do
Raise the
that,
roof,
Cooper.
roof.
You meant to do that, huh, John?
I did.
Yeah.
You know what I'm talking about, bro.
Yeah, I'm on.
Shaka.
I got you.
So, okay. So thanks for, I know a lot of people don't, you can't handle him with the
He
shotgun.
did, no, I just love it that much. I've just missed it. That's all.
So we're talking about the disease model of addiction. What are some other models? I know I don't want to get into really what they are, but maybe kind of just some brief things and why they're not really, don't really make sense.
Well, I think that because I thought about that, and I think a lot of these other models, for lack of a better word, are things like traditional ideology that it was a moral failing, and so you treated it with punitive action.
Yeah.
You know what I mean? Which like it's a behavior deficit kind of thing. Like you do have total control over this. Why don't you just stop using? Kind of an idea. You know
You're
what
a
I mean?
bad
well,
person.
yeah. So let's lock this person up and just take away their. Let's
And
take.
shame them and isolate them.
Well, yeah, or even just simply like putting someone in a cell and removing the drug doesn't necessitate recovery. That's not what recovery is. That's might be sobriety, which is totally different than recovery.
Or
right?
abstinence even.
Yeah, exactly. Abstinence for sure. Yeah.
Okay.
So I mean, like, I don't even know if I'd put a name to any other kind of like model that I.
Yeah.
Maybe that's just laziness on my part.
Well,
but
they
it's-
call it, right, when we started talking about the disease model of addiction, and the argument of the disease of choice comes into
That's
play.
my next
right?
point.
So, one of the arguments it is, they talk about the aspect of when somebody is actively using, they've lost the ability to make cognitive, healthy decisions, right? They don't have the decision. Their brain, their body, everything about them is on a true autopilot to find whatever substance they want.
Those cravings that you talked about
Right.
take over, and that's something that you can't really describe. Like you're probably one of the non-addict people that understands it best, right? But like cravings are like, think about that craving. I'm trying to
No,
describe
I
craving
mean,
to people listening that have never.
I will
experienced them.
say that I have experienced that before, but didn't know what it was at the time.
Okay.
So
I had a guy today tell me, I haven't felt any cravings. I said, okay. And like before I could even go on, he said, it's just like sometimes I just get bored and I just really think about using. And so I just go back to using. And I was like,
that's
tell
craving,
me
bro.
about that thinking about using. You know, like what's so wrong about not using that gets you to want to use again? You know what I mean? No insight into what a craving was. I think people romanticize that word, right? Like you're sweating and your mouth's watering and your heart's
Yeah.
racing, which does happen.
But I
Right.
think that's what they think a craving
Extreme.
is.
Yeah,
That's
right.
that extreme craving we see. I've talked about alcohol and sat there and watched somebody have like a visceral reaction,
Right.
like mouth
Right.
watering, sweating, panic. But like sometimes it's not even. It's as simple as just like, I just had a thought. Like that's a craving.
And it snowballs.
Yeah. Like
When you have absolutely zero control over it.
It's a good question.
Like, well, like that thought
Oh,
occurring.
yeah, yes. I would agree with that.
Like zero control whatsoever.
Yeah, the thought
and
will come
without
into
the
your
coping
head.
skills,
Then you're victim to it.
like
Yeah.
that thought snowballs and it will control it has controlled my behavior
Right.
to the point
Yeah.
where I won't make a healthy decision and I'll do something that is against my best interest. I'll give into that craving and use drugs or alcohol.
yeah.
That's why, like, when people don't understand it, then in this context, like going full circle, it's like you hear all the time, like, well, why don't you just not use? Just stop using. They don't understand that, right?
Well, and that's so, and I really wanted to talk about, because I really like talking about the midbrain taking over, shutting down the frontal lobe. And that's kind of why, right? That's why I don't stop using and why I do these absurd and insane things to get my hands on the substance that's actively destroying my life.
Yeah, because if I'm not wrong, or if I'm remembering right, I think that the frontal lobe is where you rationalize, you make decisions, you weigh
All
consequences.
logical thinking.
Yeah, exactly.
And it's not fully developed until you're like 24 or something like that.
For
and
males,
men,
yeah.
It's like 20 in women.
Mine's probably still not. I'm 30, you know, still struggling through
Mine
that.
just finished.
Got me, John?
Shaka, bro.
Thanks. Thanks, buddy.
But yeah, so the midbrain, like, I mean, correct me if I'm wrong. I'll just do a layman's description, but like, it's kind of your, you know, the food, sex, survival part of your brain, breathing even, is where the craving for drugs and like it's drugs and alcohol are paired with survival. And when you're having a craving, that midbrain will shut down the logical thinking part of your brain in order to make it easier to get the drug and alcohol, whatever.
That dopamine and glutamate rush, bro.
Yeah,
Yeah.
it's true. It works its way up into necessities like eating and sex and water. Yeah, for
Sleep.
sure.
Yeah.
Yep.
Yeah.
Definitely.
And it'll trump all of them after
Yeah.
a certain point. Okay. So it's a disease of choice. What does treating a disease of choice look like? Right. So now you have a disease model of addiction so that you can treat a disease, right? That's the ultimate goal of even creating that model. So what is treating addiction as a disease?
Remember those first 6 dimensions I mentioned, the American Society of Addiction Medicine dimensions?
Yes.
That's why Northpoint and Ashwood have such a powerful treatment regimen surrounding the disease model of addiction, because especially somebody that goes through our full continuum of care, which John and I have both seen, working both at Northpoint and Ashwood, and still continuing to work at both, essentially, you know. We help people understand and we help people mitigate the severity of their withdrawals in the inpatient, because that's a lot of why people don't get off of it. At home, they start to feel shaky, they start to feel crazy, and then you've heard the phrase take the edge off, right? Because their use is to such an elevated point to where it's normal to have, like, for instance, that much alcohol in your system at all times.
Yep.
Abnormal not to. So we help them, you know, we help them get through the withdrawals, and we look at their biomedical condition, and we address any minor issues that we can, and we get referrals to major things that people need help with. And then John and I really step in and start helping people look at their emotional, cognitive, and behavioral experiences.
And just to get them stable, right? Because then Ashwood
Exactly.
is when they kind of
Yeah.
really dive
Exactly.
deep into the
Totally.
causes and issues and coping skills and all those things.
I would-
Maybe not Ashwood, but outpatient.
Yes. I
Preferably
would say
Ashwood.
that. I would say that. There it goes. Just left my head. Hold on. It's right there.
You got it.
Oh, I would say that the thing that John and I really try to drive into our patients, that John does a really good job at because of his job experience, is accountability. Because that's where it starts to get kind of tricky, because, for instance, one of the things I did before I worked at Northpoint was I did trauma counseling with refugees. You don't really talk a lot about accountability with someone who had their family killed in front of them. You know, but somebody who's driving drunk through downtown Boise and crashing into trees on islands and wrecking cars and stuff like that, you don't really have a choice. You know what I mean? You have to look at what your role was in those things and take accountability for it, because if you don't do that, you're not going to have motivation to continue on and even do an outpatient program.
Or even feel like you can in some
Yeah,
cases.
exactly. Perfect. For sure.
This is going off of my confrontation 2 weeks ago when you were part of it.
Which I don't remember.
When we were
In his apartment?
confrontation, not apartment.
I was
thought
a
you
part
said
of it.
in
I was
his-
a part of
Oh,
it.
he was a part of it.
Oh,
No,
yeah. Yes. Oh, boy, that was... I learned a couple things that day.
Let's run me through it.
I'll let Daniel do it.
No, John, you were the master. You were the
guest.
mastermind of it.
Come on.
You're the guest.
You witnessed.
Are you talking about the...
R2.
Yeah. So we had 2 young gentlemen from kind of more rural areas of Idaho, and they were disrupting our milieu. Essentially, they were being really disrespectful. They had reported all sorts of stuff that they just didn't really seem like they really cared about too much. You know what I mean? Like stuff that to anybody
really
else,
give a shit.
looking at it, you're like, holy cow! Like that's that's a pretty severe thing you've done. You know what I mean? Burglary, people overdosing and dying that they sold drugs to, stuff like that. You know what I mean? And so John and I, and then one of them basically verbally accosted one of our recovery technicians, right? Mm-hmm. We pulled him into an office, and I just kind of, it's funny because John does a much better job than I do, like really driving that in. So John's just trying to square with them. You know what I mean? John, you know, it's like, I'm not the soft pillow counselor right now. Like I'm trying to help you guys understand like how people are perceiving you and why. It's because of what you are doing to people. And I'm like, but guys, like, it's okay. Like, how are you feeling right now? Like those. And John's like, no, it's not going to go anywhere. You know, it was kind of funny. It was kind of interesting. But then I left. I kind of felt it out. I asked John, I'm like, should I walk out? John's like, yeah. And I look through the window, the kid's crying and hugging John. You know what I mean? Like you get through and you help people feel that pain, then all of a sudden something clicks because we're all human and we all want that connection and we all want to be a part of something, right?
Well, and holding somebody accountable, it's like, to me, I just think of being a parent, right?
Yes.
Like that parent that lets you get away with anything. Like, yeah, you love them in that moment, but like they're fucking you over royally, right? And like my dad was the biggest hard ass ever. Like when he grounded me. Like I was doing work. I was not allowed to leave the house. And like he did those things. And now I'm like, I thank my dad for everything I have in my life.
Yeah.
And it's kind of that same thing that you're doing. And I'm sure you're doing the same thing with the kids you coach.
Yeah. I mean, it's just coming to those
Like
understanding.
you care, you do the hard things.
Well, not everybody's going to understand. When we teach and we educate our patients, not every person is going to understand. You know, I think one of the things that we've been successful with, especially with at Northpoint right now, is the variety of counselors that we have.
Yeah.
Right. So, you know, we have Cassie, who's great at dealing with and processing trauma and emotions,
Grief and loss
and all that stuff. Daniel does a really good job of really getting into emotions and what does that look like and why are you presenting like this. David does amazing. Me and David kind of do the same because we have the similar background, but it's not so much of not being empathetic, but kind of holding that accountability. Yeah. Like, listen, let's cut all the shit. And like, let's really look at that because, you know, every one of our patients is different when we educate.
Yeah.
I mean, it's just like school, right? Not every single student is going to learn the exact same way.
Yep. You know, and maybe I'm out of the way for saying this, but I feel like I've noticed this more and more, and I truly believe that I think counseling and counselors, especially given the context I'm in, like coming out of school and being in a cohort of people that wanted to do this for a profession, and being a social worker, like you want people to feel good about themselves, right? And there's a lot of worth in that. There's a lot of merit to that. But in order to viably feel good about yourself, like in a way that really matters, you first, again, as John was saying, like you've got to feel that pain of just recognizing that there's a balance to everything. No tree can grow to heaven unless its roots reach down to hell, right? It's Carl Jung.
God damn.
It's Carl Jung right there. And it's true though. You cannot identify with your capacity to be good and do good until you can identify with your capacity to make mistakes and do wrong things.
And accept that and recover.
Yeah,
and grow.
exactly. Yeah. If we knew what adversity brought us, we'd greet it with open arms. You know.
God damn, just look at
That's a
Fred Nietzsche over here.
That's a general conference quote, John.
It wasn't Nietzsche. Yeah, that's
Mormon talk right
that's
there.
General conference, brother.
Yeah. I can't remember who said it.
I was just throwing out some of the philosopher.
It was Gordon B. Hinckley, was it?
I hope so. 'Cause I love Gordon B. Hinckley.
Rest in peace.
Yeah. All right.
So we kind of got away from the disease model addiction, but that's totally fine.
How is that away from it?
No,
that's not away from it at all.
That's education.
Because if the choice is do you use or not use, that's a stupid choice.
You really did.
Or people saying, I just want to be happy. You can't accomplish that goal. You know, you have
Without
the disease model.
disease
Exactly. So it's taking accountability for the stuff you've done and then learning how to process that out and figuring out what kind of coping skills you're going to use in the future when you experience bad stuff. Because the disease the entire time is going to be saying, no, you deserve to use. You deserve to do this. This is too hard. You need to. Yeah, like, and I tell people more and more, like, from this point on, there's not a single thing you can experience in your life that has nothing to do with your recovery. You know, because it's the same organ, the brain, is the same thing that's affected and the same thing that continues to experience life.
All right. Is there anything that you want to say to anybody that might be listening, whether they be a clinician that might be coming into the treatment industry or even the mental health industry that might be dealing with co-occurring, whether it's somebody that might be suffering from the disease model of addiction or somebody that has nothing to do with addiction and is just trying to educate themselves?
Well,
Run.
what? Run?
Run.
I would say that, honestly, I know this might sound cliche or whatever, but it's staggering the amount of miracles I see working at Northpoint and Ashwood. It's just like, it's almost alarming. Like it's amazing because the statistics are grim. You know what I mean? Like, a lot of people don't make it. A lot of people die. I have people in my family and in my friendships who have died from the disease, right? But there's also a lot of people who find that recovery and totally change their lives, and it just, like, you can't help but, you know, feel your life change a little bit too. And so, you know, and then lastly, for people going into this field, just be patient and be willing to learn. And especially, like, from where I remember coming out of grad school, wanting to know how to do it so bad and realizing it just takes experience and time. You know what I mean? Just be patient with yourself and be open to learning from everybody.
Yeah.
Okay, I'm done. I'm off my soapbox. Sorry, Cooper.
That was great.
Anything you want to add?
I got nothing.
Shaka? Couldn't agree with you more.
Chakra.
Cool. Guys, thank you for joining us. We forgot to ask at the beginning, but make sure you hit that subscribe button, that like button, and please, 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 just tell one person that you think would get some value out of this episode. One person that maybe needs to hear that addiction is a disease and it can be treated and you can recover. Just help us reach people that need to hear our message. Once again, this is No Way But North, where we talk about the miracles of recovery and the tools used to achieve them. Thank you.
Adios.
Peace.
If you or a loved one are struggling with addiction, call 1-877-648-3125. The views and opinions expressed in No Way But North do not reflect those of Northpoint Recovery or any other institution or organization.